Srikanth Kondapalli. He is a professor of Chinese studies at the Jawaharlal Nehru University. Joins us now from New Delhi. Good to have you on the program again, sir. Now, India becoming the second country to surpass the 5 million mark. Certainly a grim milestone, but it doesn't finish there. Number one in terms of new daily infections, India is leader. A number of daily deaths, again, India is leader here. How do you think the government is handling this?
Well, I think initially India made a good measure by locking down the entire country in late March. What we have seen currently is between July to August, September, where we have had the number of cases doubling up. And typically it is taking about roughly 32 days for doubling up of the cases. But the silver line in the whole episode is, of course, 1.64% death rate. That is generally lower in compared to the global averages. And the other silver lining is, of course, the recovery rate is pretty high, over 80%. So that is still, but that doesn't provide much relief because the virus is spreading into the rural areas where 65% of the people live. And medical care facilities in the rural areas are relatively dispersed and quite inadequate. For instance, there are just about 20% doctors available in the rural areas. Also, the number of beds, hospital beds, are very limited. The testing facilities are mainly focused in the urban areas, where we saw much of the infections between March to roughly about August this year. So the worrying thing about, of course, is the rural areas where the spread has been quite increasing. Initially, the government has opened up the agricultural sector because there was not much of infections. This is roughly about March and April this year. However, the urban to rural reverse migration has also happened with the migrant workers going back home from the cities. So that has created some trouble in terms of the spread towards the rural areas. Since the infrastructure is quite inadequate in the rural areas, there has been some concern expressed.
It's actually very interesting, and I want to talk about this Sero survey showing that nearly 70% of the COVID cases are actually in rural India. So you talked about a little bit about the reasons, but what's interesting is when you look at inner city slums, this percentage is much lower, nearly about 20%. Why do we see such a stark difference between sort of a population, a densely populated area like inner city slums, and ones that are sort of less densely populated, loosely populated in rural areas where the infection rate is so high?
Well, in the slums, especially in Maharashtra, in Mumbai, as you rightly said, there is the densely populated regions, but they also have a lot of testing facilities. And the hospital beds and other infrastructure is quite available. And since the initial focus was on the slums, there was a lot of attention paid towards these. Even then, Maharashtra, where Mumbai is located, also has the highest number of cases recorded so far. Out of 758 districts that India has, nearly 100 districts initially were affected, mostly in the urban areas. Now, these are spread to almost all the districts. So that means that the virus has spread back into the rural areas. So that is the key issue here. The number of cases every day that are being tested are also pretty high. And despite a lack of vaccine, we have also seen a number of recovery cases. While it is true that rural areas, there is less densely populated ones, but the influx from the migrant laborers has been the major bane in the whole episode.
Okay. All right, Srikanth Kondapalli live for us from New Delhi. Thank you very much for coming on. I do appreciate your analysis.